Hello everyone. Today's video is about a couple of questions. One is about using proteolytic enzymes and whether they can help to break down or degrade or shrink uterine fibroids. And then the other question is about, oh my gosh, I don't even remember now. Right, hypoglycemia and how that might be connected to the gut microbiome. So before jumping into the answers to those questions, if you don't mind taking a moment to quickly share, subscribe, and or post a quick comment on the video, I'd really appreciate it. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So the question about the proteolytic enzymes goes like this. So it says, my chiropractor suggested I take proteolytic enzymes to help me with shrinking my uterine fibroids. Have you ever heard of success stories in this? And also, is it okay for me to take them in the morning on an empty stomach, but mixed with some applesauce? I have a really hard time swallowing pills, and I feel I need to mix it. But I worry even just some applesauce would potentially hinder how effective they are. So thank you for the question. Of course, I can't give any direct advice about what you should do with your proteolytic enzymes. You should ask your chiropractor for that direct advice, but I think I can chime in a little bit on this in terms of my experience. So I think proteolytic enzymes are great. The ones that I use in practice are primarily nattokinase and serratiopeptidase, sometimes known as serrapeptidase. There is another one called lumbrokinase, which to my understanding is the strongest of them all. It's just very, very expensive, and it can be very hard to access here in beautiful Canada. It's kind of ironic because one of the best companies, one of the only companies that makes lumbrokinase is located in Canada, but for Canadians to buy it, they have to buy it from a third party in the States, in the United States of America, and so they have to have it shipped from the company to the US, and then they buy it from the company in the US, which makes no sense whatsoever, but that's my understanding of it. And I say that because I've looked into ordering it before, and that's the method that needs to be done. And it's just very, very expensive, especially because then it's converted into US dollars, and our Canadian dollar is very weak and compared to the US dollar, and it's all very unfortunate. So anyways, serratiopeptidase and nattokinase are what I have used, and they seem to work well for the purposes that I've prescribed them for. So proteolytic enzymes, as the name suggests, they're break down proteins. And I've certainly heard about that being used, heard of them being used for fibroids and breaking down other tissues in the body. There are some protocols out there that recommend proteolytic enzymes in the context of treating cancer and trying to break down like capsules around cancer cells and things like that. To my understanding, I'm not 100% sure, but I have never seen any literature. Well, I'm 100% sure that I've never seen any research literature looking at that or proving or demonstrating that. I've heard lectures about this from various sources before. I just haven't seen any references within those lectures. My understanding is it's more theoretical. It's not theoretical that the proteolytic enzymes break down tissues. They do, but whether or not they're actually able to break down fibroids or shrink fibroids, or whether they're able to break down cysts or break down hard tissue around indurated tissues, what I was looking for around tumors and things like that, or breaking down cancer, like encapsulated cancer cells or whatnot. These are things that to my understanding, are more theoretical. Now, if anyone listening to this video or watching this video is aware of any research literature looking at this, I would be very interested to look at that. I think it'd be very cool to see, but I believe it's more, it's certainly something that's been done. Like the chiropractor who recommended this, is not like they cooked it up in their basement. It's like, oh, this sounds like an interesting theory. It's something that has been talked about for years. I've been practicing for 15 years. I heard about this prior to starting my practice career. I used to read a lot of books and things on alternative health and complementary health prior to becoming a naturopathic doctor, and so this is idea's been out there for a long time. I just, again, haven't seen any research literature actually looking at whether this is feasible or not. I also haven't had any patients where it's been successful, and so I'm not saying that to be a glass half full, or sorry, glass half empty guy over here. I haven't seen it play out in practice. I'm part of different online groups of naturopathic doctors, functional medicine practitioners, and whatnot. These like Facebook groups and things, like these private groups that are just for clinicians, and we can ask each other questions and talk about cases and things like that. And in the past, I've seen message threads where it's like, hey, like, has anybody had success with enzymes, or what's your enzyme protocol for breaking down fibroids? And the what's very nice about those groups is that there are clinicians who are experts in various fields, whether they're experts in women's health or men's health or herbal medicine or whatever it is, and they'll chime in in some of these cases or message threads and say, like, I've never seen this work, or or I've seen this work, or whatever it is. So there's a lot of collective wisdom on there in these groups. So I want this type of therapy to work. It would be wonderful if it would. I haven't seen it work in my practice, and I also haven't heard any reports from reputable sources that it has worked from these experts, in this case in women's health. So that's my knowledge base on it up to this point. Now, I have not recommended this type of therapy to dozens or hundreds of patients. I've had a few patients over the years where we've tried things like this for uterine fibroids, amongst other things. Like, one of the other things that's sometimes talked about is working with more hormone balancing therapies, like different herbs and things like that, to try to, if a patient has excessive amounts of estrogen, estrogen dominance or whatnot, then maybe by mitigating that, it'll help to reduce kind of the growth signaling to the fibroid. And I think that type of therapy might be helpful. It's always hard to know for sure, because maybe the fibroid was growing, and then it's like, okay, I've grown enough. I do think those types of therapies can be helpful in terms of maybe slowing down the rate of growth, or maybe stopping the growth of a fibroid. But in terms of actually shrinking a fibroid, I think, in my experience, once the horse has left the barn, it's really hard to get that horse to go back in the barn. This is a fibroid horse in this analogy, of course. So again, I'm not saying that to be glass half empty. I'm just saying that's been my honest experience up to this point. And so again, love to hear in the comment section, Dr. So-and-so, or they don't have to be a doctor, someone, some clinician, some whoever is like, it's all this success and there's these studies and I'm just doing it wrong. And I'd love that for that to be the case, but I haven't seen it in practice. So that's my 2 cents around that. As far as in my practice, when I do recommend proteolytic enzymes for patients who can't swallow pills, then or there's other things, like say activated charcoal, for example, which should ideally be taken away from food, or other things that should be taken away from food. In my experience, if it's mixed with like just a little bit of say applesauce or something like that, a little bit of smoothie, a little bit of yogurt, whether it's dairy free or dairy containing yogurt or whatnot, those things are usually fine. I mean, if I was prescribing a proteolytic enzyme to my patient, it's like, oh, if they said to me, should I put it in yogurt, should I put it in applesauce, should I put it in a smoothie, I would generally say, well, just put it in whatever doesn't have protein in it, because we don't want it to break down protein. Where applesauce, of course, is very, very low in protein. So anyways, I'm going to stop talking about this now, because I think I've been talking everybody's ear off about this, but I hope this information was useful, and I hope that you find some good answers to what's happening with your health there. The other topic here is about hypoglycemia, and it says, please tell us about cases involving hypoglycemia, reactive or otherwise, and what is the connection to the gut microbiome? So the person asking this question, thank you for the question. And if you don't mind just clarifying, maybe in a comment on this video, cases involving hypoglycemia in what regard? So maybe a little more specificity there. In terms of the connection to the gut microbiome, there are certainly studies that have been done showing that microbiome, certain probiotics, for example, it can be helpful with blood sugar regulation. That being said, I really haven't seen much clinical correlation with different probiotics making a difference with blood sugar regulation. What I have seen the most difference in, and maybe this will answer your underlying question around the hypoglycemia, is what I've seen the most benefit from is folks just making sure they're eating enough protein with their meals. Too many folks, I think, they just eat carbs and not enough protein or fat to kind of balance out the carbs, and so the carbs are absorbed too rapidly, and it seems to lead to blood sugar dysregulation. So the biggest answer, or the best answer, most broadly effective answer to the hypoglycemia issue, in my experience, has been just making sure a person is getting enough protein with each meal of the day, not eating carbs on their own, not eating, not drinking like lots of juice or eating fruit or things like that away from other things. That seems to be the most helpful. And then sometimes taking things like berberine and chromium can be helpful for blood sugar regulation, but I'd say 9.5 times out of 10, just getting protein spaced out through the day is the thing that seems to make the most difference. But if there's more nuances to this question, just fire away and I'll answer it in a future video. Otherwise, I will leave it there for now. If anybody has any questions or comments about any other topics, just post in the comment section below.